Hello, everyone. Hello, Facebook. Hello, IG. It is Thursday afternoon, going into the evening. I am sorry for coming in. I usually come in a little bit earlier. It's a little bit later today. I had to charge my phone. Um, but we are here, guys. So today's topic, guys, we are continuing our conversation about knees. And I am talking today about a question that I commonly get about meniscal tears. And with meniscal tears, a common question that I get with patients is that they're really trying to understand why they're feeling the way they're feeling with their diagnosis. And a common question that I get is, why does my knee get stuck when I have a meniscal tear? So I'm going to dive a little bit into that today. So basically, the first thing that we need to understand with a diagnosis like meniscal tear is like, what is it? Like, what's going on? Why? Like, what is a meniscal tear? So we'll talk about that first. So meniscal tear, guy, first of all, the meniscus, what is that? The meniscus is two circular shaped pieces of cartilage that sits in between the joint of your knee. So in the middle of the femur and the tibia, there's some space in there, and then these two circular pieces of cartilage that sit there. And think of those cartilage discs as a little bit of padding and protection. Their function is really to kind of really mediate a lot of the impact forces that happen across the knee. Okay. Now, because they are shaped the way that they are, and they're shaped around what we call the condyles, or the end part of the bones on the bottom of the femur, because they are shaped around those, they have to move a little bit when your knee bends. So when your knee bends, let's pretend this is your knee right here. When your knee bends, it slides back a little bit, kind of moving with the knee joint. And then when you straighten out your knee, it kind of glides forward and it moves with it. So it kind of moves along with the knees every single time that you move. That's the normal motion. When you have a meniscal tear, there's a little bit, usually there's some sort of rotational force that tears that cartilage. And because of that, you have what we call an interruption to the mechanics of the knee, because it's supposed to move with the knee. So if you bend, it's supposed to slide a little bit back. If you straighten up, it's supposed to slide a little bit forward. When you have a meniscal tear, what happens is that the mechanics of the knee gets affected. So for you guys, a visual for you guys, for those guys, for those of you that are a little bit more visual, if you had a low pile carpet and you had a door that kind of slid on the door, and sometimes when you close the door it kind of catches the carpet, and sometimes when you close it, when you open and when you close it, it kind of catches the carpet. Think of the meniscus kind of like that way once you get a tear. So the door is going to close, but it's not going to close efficiently. It's not going to close very well. So that's kind of how a meniscal tear kind of affects the motion at the knee. So when patients come along and they say, hey, it seems like I have a meniscal tear, like I kind of get stuck when I'm bending my knee, or I can't straighten my knee all the way. That's exactly what's happening. When that door tries to close, either open or close it, and it passes over that tear, what happens is that it gets caught or it gets stuck. With a door, you can force it open. With the knee, not so much, because there's not that much space in the knee. Okay. So that's why when you are having a meniscal tear, you start getting that catching and that locking sensation. That's very typical if you've had a significant tear. Okay. Hey, Stefan, how are you? If you have any questions, drop it in the comments to me. We're talking about meniscal tears today. All right. So that basically is the whole concept behind your knee getting stuck. Okay. Again, with the meniscus, it is important that the meniscus glides backwards, or slides forward once your knee is straightened out, backwards when the knee's bending, sliding forward when the knee is straightening out. If you have a tear, that those mechanics change, and if those mechanics change, sometimes the knee gets stuck. You can't straighten it all the way, or you can't bend it all the way. That's very, very typical when you have a meniscal tear. Okay. So that's a little bit about meniscus tears. I'm going to talk a little bit more in terms of the symptoms that a lot of people see with meniscal tears, because that's also very common. It's very difficult for a lot of people to be like, well, how do you know? Meniscal tears are usually pretty obvious, at least to the trained eye, if you know what to look for. I'm just going to check the comments here to see if we have any questions. Instagram looks good. IG on Facebook looks good. So I'm going to talk a little bit more about how um, with meniscal tears, how do you know that you may have a meniscal tear? So usually the mechanism of injury in terms of how do you actually get it, usually is by some sort of compression and rotational force. So for a lot of people who are very active, if you're into sports, if you play football or any sort of running activity where you have to pivot very quickly or you have to cut and turn very quickly, that's a very common way for you to get it. If you are loaded with something and you've had some sort of rotational force happen with you, like let's say you're lifting something very heavy, you're lifting very I don't know, very heavy groceries, and then you make a quick turn and you pivot and your foot is planted, there's a good chance you may catch your meniscus and do some damage that way. So that's usually the common mechanism of injury with meniscal tears. So you would find that it happens more in terms of if it's a traumatic injury, like it just happens like that and kind of takes you out. That happens more with the active population who is into sports. Or for some people, you can have small tears over time that start really adding up and start giving you a lot of the symptoms that you would have with it. When we are talking about meniscal tears in terms of patients, what you would find is that you usually have a lot of swelling, you have pain, deep achy pain on one side of the knee versus the other, because again, you can have the medial or the inside meniscus or the outside or the lateral meniscus happening that can be affected, and you would see that you have like deep achy pain. You may notice some swelling, but more importantly, you would notice that there's specific pain when you do one motion. So if you bend it a certain way, it's going to be painful. If you try to straighten it out a certain way, it's going to be painful. And also, depending on the degree of the injury, how much of the meniscus is torn, what level or what area of the meniscus is actually torn, what kind of tear is there, because there's several different types of tears. It could be longitudinal, it could be radial, it could be a bucket handle tear. There's so many different descriptions of the quality of the tear, the quality of the injury. And then you're going to have different presentations. Very typical for meniscus tears, you're going to have some sort of locking injury. So you feel like you're trying to straighten out, you cannot straighten it out all the way. Or you feel that as you're walking through, you may feel like there's something catching. So every time you bend your knee, it kind of snags on something, and then you kind of keep going. Or you may feel like you may have like instability, like you try to put your weight and like try to stand up from a chair and it kind of gives away a little bit. So when you hear your provider say, do you have any locking, any catching, any giving away or getting stuck, they're usually looking for those typical signs that you may have some sort of meniscal injury going on. Okay. So that's a little bit of background about meniscal tears, guys. Again, the question today was, why does my knee get stuck when I have a meniscal tear? Cliff notes on that. Basically, if your meniscus is torn, you have an interruption to the mechanics of your knee. And if that's the case, when you try to straighten or you try to bend your knee and you go through that range of motion, it's going to get stuck because that meniscus now kind of gets in the way of the knee moving the way that it should and gliding and sliding the way that it should. And that's the stuck feeling that a lot of people have. That's the cliff notes of today's question. Okay, tomorrow we're going to talk a little bit more about strengthening. I got that question in a message from a patient who wanted to talk about, how do I strengthen my knee? If there are other questions around knee injuries or knee pain, please let me know. I'm happy to continue this into next week. If there are more questions, if it's something personal, shoot me a DM. If you don't want to put it out publicly, I'm happy to answer your questions. Also, 𝘿𝙧 here. Guys, we are rounding up for Friday. I'm very excited for Friday for some reason. I don't know why, but I am. So hope you guys are having a wonderful day, and I will see you guys tomorrow. Have a good one. Bye.